Dr. Reichman, please dial the operating room. Dr. Reichman, dial the operating room. Dr. Shackman, please dial 244. Dr. Shackman.
Caregivers wash their hands way too infrequently, and that's how diseases spread.
I think it's the most important product advance I've seen in hand washing in 20 years.
It's become second nature for me.
And one local Santa Barbara company is doing its part to help protect us from contracting SARS with a product called Sprix. It's in this little bottle. And joining me this morning is the inventor of Sprix, Dr. James Villaveses, and infectious disease control coordinator Denise Blake. Thank you so much, both of you, for joining us this morning. What is in this bottle?
It's probably the most effective method of germ control in a hospital.
Have you ever heard of a patient entering the hospital with one disease, only to contract another during their short hospital stay? Lack of proper hand sanitation could be the culprit. The spread of infectious disease is occurring every day. It is the fourth leading cause of death in the United States. The Center for Disease Control and Prevention in Atlanta, Georgia, issued guidelines for hand hygiene in healthcare settings, explicitly stating alcohol sanitizers should be used as the primary hand antiseptic when hands are not visibly soiled. Hand decontamination should be done with alcohol. The CDC directly attributes 20,000 and possibly as many as 50,000 deaths each year to hand-transmitted nosocomial infection. And the CDC is taking steps to do something about it. Don't you think it's time you did too?
If I have to use soap and water at a sink, that takes a minute, sometimes a minute and a half. Each time I have to walk over to the sink, I have to lather up, I have to rinse off, and I have to dry off. It takes a long time to do that, as opposed to using this device, which takes 10 to 15 seconds. Multiply that times dozens, hundreds of times in the course of an 8-hour shift, and you can see how much time we save.
Do you get frustrated having to stop and wash your hands with soap and water, or looking for a wall-mounted alcohol dispenser? The CDC has acknowledged use of soap and water can cause dermatitis, and you might think that alcohol sanitizers would dry your hands, but they don't. Special emollients actually moisten and soften hands with repeated use. In fact, studies have shown alcohol is more effective than soap and water or any other antimicrobial agent in decontaminating hands.
You know, it's a problem in modern hospitals that people don't wash their hands enough between patient care. What could be easier than wearing something? Because it's second nature.
Because it's quick, it's easy, and it's always there. I just reach down, it fits right into my hand just like a cell phone or a pager, 2 squeezes, and I have all the alcohol I need to decontaminate my hands. It couldn't be any easier. Compared with hand washing, it's faster and it's more effective. It does a better job of killing the organisms that I could otherwise transmit from one patient to another.
Stop hands as a transmitter of infection. Avoid contamination pitfalls. Eliminate human foibles. And prevent loss of focus by improving hand hygiene compliance with Sprix.
Rather than trying to change people's behavior by educating or changing your expectations for them, this changes the system, so it makes it so easy that just a couple of squirts and you've decontaminated your hands.
A physician earning $120,000 a year will save an estimated minimum of 30 minutes per 9-hour shift. That translates into a savings of $25 per physician per day. The cost of Sprix, $1.50. Average annual savings, $5,800. Multiply this times the total number of hospital workers, and the numbers could easily reach into the millions. And the value to society as a whole, priceless. Make the commitment to your personal safety and protect yourself from hand-transmitted infection with Sprix, the hand sanitizer that you wear.